Assalamualaikum and good day to Doctor and all my fellow friends in GTN 218 Nutrition in the Life Cycle. We are from Group 11, which consists of 4 people, which are Amanina, Nabihah, Syaza and Aisyah. We will talk about illegal drugs and pregnancy.
Illegal drugs are chemicals and substances that are not prescribed by a doctor and a person is not allowed to use or own it, as it is highly addictive substance that will give you negative health effect. As illegal drugs will give negative effect to users, thus illegal drugs consumed by a pregnant mother will not only harm the mother, but it will also give severe health consequences to infants. This is because many substances can easily pass through the mother's placenta, so whatever substance consumed by a pregnant mother will also reach the fetus. According to Substance Abuse and Mental Health Services Administration's 2013 National Survey on Drug Use and Health, 5.4% of pregnant women between ages 18 to 44 had used drugs in their first trimester, 4.8% in their second trimester, and 2.4% in their last trimester of pregnancy. The common types of drugs that being used by pregnant mother are cocaine, heroin, and methamphetamine, and all of them will give negative effect to both mothers and babies.
The first drug that I'm going to talk about is cocaine. The other names for cocaine is coke, crack, flake, snow, candy, bomb, and toad. The consequences of cocaine usage during pregnancy is that the cocaine will enter the fetus circulation, and since the elimination of cocaine in fetus is slower as compared to adults, so the cocaine will remain longer in the fetus as compared to adults. Effects of cocaine to the pregnancy includes increased risk of miscarriage and increased risk of premature labor. Studies have found that women who use cocaine during their pregnancy have 25% increased risk of premature labor. Next, the effects to the fetus. The fetus have increased risk of kidney defects, increased risk of heart defects and arrhythmia, and increased risk of placental abruption, which can lead to severe bleeding and fetal death. And lastly, effects to the baby after birth is that the baby may have smaller head circumference and is growth restricted. The baby may also suffer from withdrawal symptoms such as sleeplessness, muscle spasms, and feeding difficulties. Learning difficulties can also be the result of cocaine usage when the kid gets older.
Heroin is highly addictive drug and many people find it extremely difficult to stop using it. Other common names are horse, smack, junk, and crystal. Heroin is an opiate drug made from morphine, the natural substance in the seed part of the Asian poppy plants. It can be a white or brown powder, or it can be a black, sticky glue that called as black tar heroin. Heroin is usually injected or smoked. Purer forms of heroin are inhaled. Using heroin during pregnancy can cause serious harm to mother and also significantly harm her baby. This is the effect of heroin used to the pregnancy. Firstly, it can lead placental abruption, where placenta separate from the wall of the uterus before birth. Placental abruption can cause very heavy bleeding and can be very serious for both mother and baby. It can also increase the chance of premature birth, where baby is born too early before 37 weeks of pregnancy, lead to low birth weight and increase the risk of neonatal abstinence syndrome. Heroin intake also gives effect to the baby. The baby may high risk to get congenital birth defect, either involving the heart, spine or eyes. They can also have breathing difficulties. It happens when a baby's lungs are not fully developed and cannot provide enough oxygen. It also increases the risk to get developed intracranial hemorrhage, which means bleeding within the brain. Babies can also be born addicted to heroin and can suffer from withdrawal symptoms such as convulsion, irritability, and joint stiffness.
In addition, methamphetamine is one of the drugs that give a harmful effect to the pregnancy. Methamphetamine have their street name such as meth, speed, crystal, glass, and also crank. Methamphetamine is a widespread illicit drug. It is a powerful, highly addictive stimulant that affects the central nervous system. It also comes in a white, odorless, bitter-tasting crystalline powder, and it is easily to dissolve in water or alcohol. If this methamphetamine is taken during pregnancy, it can pass through the placenta and affect the mother as well as impact the development of the baby. So, here is the effect of methamphetamine consumption during pregnancy. First of all, this kind of drug may give a harmful effect to the pregnant woman, include it will cause the higher risk of miscarriage for pregnancy, placenta abrasion which causes the separation of the placenta from the uterine lining and causes the heart rate of the mother and the baby to increase. It also leads to poor appetite during pregnancy and also increase the blood pressure and can lead to the kidney damage, stroke and heart problems. Meanwhile, the consumption of methamphetamine during pregnancy also gives a serious effect to the baby as well. Actually, their causes is quite similar to those who use cocaine, but this methamphetamine can cause the baby get less oxygen, which can lead to low birth weight. Methamphetamine also increase likelihood of the premature labor. Baby become addicted to amphetamine, or we call it as a meth babies, and also cause the withdrawal symptoms like tremors, sleeplessness, muscle spasm, and feeding difficulties. So, all these causes may lead to restrict in growth and distress of the baby.
In conclusion, pregnant mother must be responsible for what they consume. It is so important for them to carefully consider for substance that they take into their body to ensure their baby born healthy. This is because if you use illegal drugs, so does your unborn baby. Pregnant mother can seeking for professional help from doctor or healthcare to slowly stop consuming illegal drugs. They will be able to provide you with the most appropriate advice on drug treatment service that best for your situations. I think that's all from us, Group 11. Thank you for watching.